Have you ever wondered if it's still okay to masturbate after 60? You might hesitate to even ask that question. Many men do. Maybe you've noticed changes, less sensitivity, slower arousal, or even discomfort. And suddenly, something that once felt natural now feels uncertain. You might think, is this normal? Or am I doing something wrong? That quiet worry mixed with curiosity can lead to guilt or confusion. But here's the truth. Sexual pleasure doesn't have an expiration date. As a doctor, I can tell you that masturbation after 60 can actually support your health. It keeps your pelvic muscles active, helps blood flow, and even supports mood and sleep. But there's a right way to do it. Many men unintentionally make simple mistakes that cause soreness, strain, or performance anxiety. It's not about doing too much. It's about how you do it. If you've ever felt fatigue afterward, experienced dryness, or lost sensitivity, this video is for you. We'll talk about what's really happening in your body as you age and how to keep your sexual health safe, comfortable, and satisfying without shame or fear. You'll learn the 3 big mistakes men often make after 60 and how to avoid them with small science-backed adjustments because pleasure should feel good, physically and emotionally, no matter your age. And I'll show you exactly how to make that possible. Let's talk honestly. Aging changes everything: our energy, our confidence, even our relationship with our own bodies. You might still feel desire, but your body doesn't always respond the same way. It takes longer to get aroused. Erections might not be as firm or last as long, and sometimes you finish and wonder, why do I feel more tired than relaxed? These are natural shifts that happen as testosterone levels decline and blood circulation slows with age. Your nerves become slightly less sensitive, skin thins, and tissues that were once elastic may lose flexibility. But here's the part no one talks about. Your mind still remembers how things used to feel. That memory can create frustration when reality feels different. You might push harder, go faster, or use more pressure just to feel something, and that's where problems begin. Excessive friction, poor lubrication, or unrealistic expectations can cause pain or even small injuries. Some men also experience guilt, especially if they were raised to see pleasure as shameful or unnecessary in later life. That emotional stress can affect sleep, confidence, and even intimacy with a partner. It's a cycle that no one should have to face alone, because sexual health isn't about performance. It's about connection, comfort, and care. So let's ask the real question. How can you continue to enjoy your body safely without hurting yourself or feeling embarrassed? Science gives us clear answers. Your body after 60 is capable of deep, satisfying pleasure, just in a different rhythm. Understanding those changes helps you adapt rather than resist them. In a moment, I'll share the 3 biggest mistakes older men make when masturbating and how to avoid them with small, practical adjustments that protect your prostate, your circulation, and your confidence. Because pleasure after 60 isn't a problem to fix. It's a skill to relearn with patience, respect, and awareness. 3 common mistakes older men make when masturbating. And let's go step by step. What I'm about to share isn't just advice. It's based on real medical science and years of experience with older male patients. The goal is simple: keep your body safe, your pleasure alive, and your confidence strong. First, rushing the process. You might think, I don't have the same time or stamina I used to, so you try to finish quickly. But here's the truth. Your body at 60 plus doesn't respond well to rushing. Blood flow to the penis takes longer to build, and nerves need more gentle stimulation. When you rush, your muscles tense, your heart rate spikes, and the experience becomes more mechanical than sensual. That tension can even reduce sensitivity, making arousal harder the next time. The fix: slow everything down. Focus on sensation, not speed. Take 5 or 10 minutes just to relax. Breathe deeply, release your shoulders, and allow blood to circulate. Some men find gentle touch or massage around the inner thighs or lower abdomen helps. That's not indulgence. It's smart physiology. You're increasing nitric oxide levels and relaxing the blood vessels that help you get and maintain an erection naturally. So slow is not lazy, it's healthy. Your body's tempo has changed. Follow it instead of fighting it. 2-second, ignoring lubrication. This is the most common and easily avoidable mistake. After 60, the skin, especially around the genitals, loses some of its natural moisture and elasticity. Combine that with thinner tissue, and friction can cause irritation, microtears, or even mild infections. Many men don't notice until there's redness, burning, or soreness afterward. That's your body saying, "I need more care." The fix: always use a gentle, water-based lubricant. Avoid oils or lotions with fragrances or alcohol. They can irritate the skin or interfere with condoms if you use them. Lubrication reduces friction, protects delicate tissue, and enhances sensation by allowing the nerves to respond more fully. If you're on medication that affects dryness, like blood pressure or prostate drugs, lubrication isn't optional, it's essential. Think of it as joint support for your skin. Just like you wouldn't run a marathon without hydration, you shouldn't stimulate without moisture. And here's something many men forget: keep the area clean afterward. Use warm water and mild soap to avoid buildup or irritation. Good hygiene keeps pleasure safe. Third, overusing intense pressure or devices. As sensitivity changes, many men subconsciously increase pressure, gripping tighter or using vibrating toys on high settings. It might seem effective at first, but too much pressure can train the body to only respond to that level of stimulation. Over time, it becomes harder to feel pleasure with lighter touch or with a partner. That's called death grip syndrome. And yes, it's real. It's not permanent, but it can make intimacy frustrating. The fix: vary your technique. Use lighter touch. Experiment with rhythm, temperature, or different hand positions. If you use toys, choose low to medium intensity and focus on the overall experience, not just the orgasm. You're retraining your nerves to recognize pleasure in a broader range. It might feel unfamiliar at first, but that's your nervous system healing, not failing. If you experience numbness, tingling, or lingering soreness, pause for a few days. Let the tissues recover. Your body's feedback is your best guide. Bonus tip: take care of your overall circulation. Your sexual health mirrors your vascular health. That means what's good for your heart is good for your erection. Exercise, hydration, and diet directly affect how your body responds to arousal. If you're sedentary or eat a lot of processed food, blood flow becomes sluggish and sexual stamina drops. A simple daily walk, pelvic floor exercises, or gentle yoga can improve both confidence and performance. These increase oxygen delivery, reduce stress hormones, and promote nitric oxide release, the key molecule behind natural erections. So even when you're not in the mood, taking care of your physical health is an investment in future pleasure. Mind-body connection. Let's not ignore the emotional side. Masturbation isn't only a physical act, it's part of emotional self-care. Shame or guilt can block pleasure just as much as poor circulation. Remind yourself, sexual expression after 60 is not dirty or desperate. It's healthy, it's natural, it's human. If you feel anxiety or self-judgment, take a few moments before beginning. Close your eyes. Breathe. Acknowledge the emotions without criticism. When your body feels safe, your mind allows arousal to unfold more freely. That's science, not sentiment. Your parasympathetic nervous system, the rest and relax mode, activates only when you feel calm and accepted. So, kindness to yourself is part of the technique. Finally, know when to seek medical advice. If you ever experience pain, bruising, or difficulty maintaining an erection that used to come easily, don't ignore it. These can signal underlying issues like vascular disease, nerve compression, or hormonal imbalance. A checkup with your doctor can rule out concerns and often lead to simple, effective solutions. Sometimes it's as easy as adjusting medication or improving circulation through lifestyle. There's nothing embarrassing about caring for your sexual health. In fact, it's a sign of wisdom. Pleasure after 60 is not about chasing the past. It's about discovering what feels good now, with patience, care, and curiosity. Because when you respect your changing body, it rewards you with better health, deeper satisfaction, and renewed confidence. Let's take a moment to bring everything together. You've learned that sexual pleasure after 60 isn't just possible. It's healthy, natural, and deeply beneficial. Your body still knows how to feel good. It just asks for a little more patience and care. The biggest message here is adaptation, not restriction. Aging doesn't mean the end of desire. It simply means learning a gentler rhythm. And that rhythm can be even more rewarding when you understand what your body needs. Remember the 3 key mistakes we covered. First, rushing. You can't force your body to respond faster than its circulation allows. Slow down. Let arousal build naturally, like a steady wave. Pleasure that takes time often lasts longer and feels deeper. Second, neglecting lubrication. Friction and dryness are silent saboteurs. They can lead to irritation, infection, or even loss of sensitivity. A simple water-based lubricant keeps the experience safe, smooth, and pleasurable. Third, using too much pressure or intensity. You don't need to fight your nerves into feeling again. Gentle variation retrains your body to enjoy a wider range of sensations. That's how you stay sensitive and responsive, both alone and with a partner. And don't forget the supporting factors: regular movement, hydration, stress management, and open conversation with your doctor. These protect not just your sexual health, but your overall vitality. Pleasure is a reflection of health, physical, emotional, and hormonal. When one part is neglected, the others follow. But when you nurture yourself with awareness and patience, everything improves. Energy, confidence, mood, even sleep. Always listen to your body. Pain, numbness, or fatigue aren't signs of weakness. They're signals asking for balance. Treat your body with the same respect you'd give someone you love. There's no shame in wanting intimacy, even when you're older. In fact, it's one of the most powerful affirmations of life itself. So take these lessons as a gentle reminder. You deserve to feel good. You deserve to explore. And you deserve to age with curiosity, not fear. Your body is still capable of pleasure, just in wiser, calmer ways. And that's something worth celebrating. If there's one thing I want you to take from this video, it's this: sexual health after 60 isn't about youth. It's about awareness. When you understand your body's changes, you can care for it with confidence, not fear. Remember, pleasure isn't something you have to give up. It's something you can redefine. You've earned the right to feel good in your own skin, safely and without shame. So take what you've learned today, move slowly, use care, listen to your body, and let pleasure be part of your self-care, not a secret, not a struggle. If this conversation helped you see your health in a new way, I'd love for you to join this community. Subscribe to the channel for more doctor-led insights on men's health, aging, and vitality. Here we talk about the things that matter, but often go unspoken, with honesty, compassion, and science. Your well-being deserves attention at every age. So take care of your heart, your mind, and your body. They're all connected. I'm Dr. Rosalia Viterbo. Thank you for spending this time with me. Take care of your health, and I'll see you in the next video.